Annual enrollment is here. And just like every other day of the year, Employee Benefits is ready to help you. Meet Joe Walsh, the city's Parks and Recreation Director. Joe says he has a fun job. As the city's Parks and Recreation Director, he encourages the people of Knoxville to be active, just as we want to encourage you to get active and stay healthy. If you missed the benefits fair or haven't seen the newsletter, you may be wondering, what's changing for 2016? Let's take a look. While there are no changes to the medical or pharmacy plans, there is a change in the networks that will take place March 1st, 2016. The University of Tennessee Medical Center will no longer be participating in Network S. Before you enroll in benefits, it's important to ask your doctor if they will be an in-network provider under Network S. Remember, care in a non-network facility due to an emergency does have in-network benefits. We do have a new life insurance vendor, The Hartford. And with this new vendor comes a new opportunity to enroll in supplemental life insurance if you've waived coverage in the past. We'll talk more about this later in the presentation. Since there are no changes, let's jump into a quick recap of our current benefits, starting with medical. Not much has changed with choosing your plan. First, you select your network, either Network S or Network P, keeping in mind that the University of Tennessee Medical Center will not be participating in Network S, effective March 1st. Next, you select which deductible is right for you and your family, $500 or $1,000. Finally, you need to decide whether you want to participate in the My Health Wellness Rewards program or not. Here's a chart with the basics of our plans side by side. Notice that both plans cover preventive services at 100%. Here are your paycheck deductions for 2016. Notice there's no increase. The total premium is increasing by 3.3%, but due to your efforts, both at work and at home, in making My Health a success, the city will absorb the total increase and your rate will stay the same. By now, you should be pretty familiar with the My Health program and understand the rewards and requirements of the program and how it can benefit you. But don't take my word for it. Check out your coworkers and their experiences. They are staying active. Officer Sutton appreciates that the city rewards him for being active. He's a big advocate for physical activity, any way you can get it. They are focused on nutrition. The Edwards decided they want to be parents that lead by example, and they're making lifestyle changes that have a big impact, not only on them, but on their entire extended family too. They are losing weight. Julie Maxwell has tapped into the resources of the center to lose weight and keep it off. She couldn't do it without the support and encouragement of her health coach. Most people join My Health for the reduced premiums, but they also have access to free or reduced prescription copays and earn HRA dollars that can be used to pay for eligible medical, dental, and vision expenses. The HRA dollars are designed to give you money through the year to help you pay for eligible expenses. My Health participants with employee-only coverage receive $32 a month. If you cover one or more dependents, you'll receive $64 a month. You may also qualify for additional HRA dollars, like the compassion contribution or prenatal benefit, as described in the chart. Those HRA dollars we keep talking about roll over, too. If you don't spend all of them during the year, they roll over to the next and are available as long as you remain covered by a city-sponsored medical plan. This includes COBRA and retiree coverage. If you expect to have out-of-pocket expenses greater than the HRA dollars you'll receive from the city, you can contribute your own pre-tax money to the Healthcare FSA. Since anything greater than $500 left in your flexible spending account is forfeited at year-end, expenses are paid from your FSA account first. When your FSA funds are gone, expenses will then be paid from your HRA. So, naturally, to get all of the rewards, there are a few requirements for you and your covered spouse or qualified domestic partner. First, you must receive an annual health screening. Be physically active and complete a monthly physical activity affidavit. Now you can do it from your mobile device through a new Blue Cross Blue Shield portal. Complete quarterly health education, which can also be done on the new portal. Manage any chronic conditions by meeting with your health coach, including tobacco use. and seek an annual well care visit for your covered children. If you don't meet the requirements of the program, you will be removed from My Health and miss out on all of the rewards. It's all about being active and aware and then recording the results. The AUBs don't look at the requirements as a burden, but as a seed that's been planted to help them enjoy life and their family. If you choose not to participate in My Health but still want city-sponsored medical and prescription drug coverage, you can enroll in the medical-only option. Medical and prescription drug benefits are available for medical-only participants, but you'll be paying more for coverage because you won't be receiving the My Health discount. And there are no built-in rewards, such as HRA dollars and lower prescription drug copays. My Health is more than activity. It's a program that focuses on your and your family's overall well-being. We couldn't have said it better, Mark. If you don't plan to enroll for city medical coverage, you can provide proof of other coverage, and the city will contribute $500 to a healthcare FSA in your name. You can then use those dollars to pay for eligible healthcare expenses incurred by you and your dependents during the year. Your prescription drug coverage is part of your medical plan. Our vendor is Optum Rx, and there's a separate ID card. Use your Optum Rx card at the pharmacy to pick up prescriptions. Every year, our prescription drug vendor may make changes to the formulary drug list, which may affect where your drugs fall on the copay list. If anything changes, they'll let you know. Make sure your address is current in PeopleSoft, and pay attention to your mailbox in November. That's how Optum will notify you. Take a look at the next slide to see the copays under our plan. Here are the copays for prescription drugs. Remember, if you choose My Health, you'll not only receive discounted prescription drug copays for medications used to treat chronic conditions, but you will also pay lower copays for non-preventive brand medications as well. Refer to the drug list at cityofknoxvilleRx.com for a list of commonly prescribed medications. If you have questions about your coverage, please call City Benefits at 215-2111. We're here to help. The Center, the city's health and wellness clinic, is a valuable resource for our employees and their covered dependents. All city employees can use the Center, but My Health enrollees receive services for a lower copay. If you're sick, call the Center to make an appointment. The Center is located at the temporary location off Mineral Springs. We are all very excited to move to the new Public Works complex upon completion. Stay tuned for more information. In addition to changes to your medical coverage, now is the time to make changes to any other city benefits you may be enrolled in or want to enroll in if you haven't before. You can read more about each of these benefit plans online at knoxvilletn.gov/benefits. Your 2016 Guide to Your Benefits provides descriptions of each plan. Let's take a quick look at these other benefits. Dental. First, the city provides a free base dental exam to all benefit-eligible employees. That includes one annual exam, one cleaning, and one set of bite wing x-rays for you every year. You are automatically enrolled in this benefit unless you choose one of the buy-up plans. Your spouse and children are not eligible for this base plan. The city also offers buy-up dental options, a low and a high option with Delta Dental, and a DHMO option through Cigna. Take a look at this chart and let me walk you through the differences. The city's Delta Dental plans give you the freedom to see a wide range of providers, and you can choose a plan with or without orthodontia. With these plans, you pay a percentage of the cost. The Cigna DHMO offers copays for services in their patient charge schedule, and there's no limit. The paycheck deductions on this plan are inexpensive, but the network of available dentists is very small. There are no waiting periods on any of these plans, and you can elect a different plan every year as your needs change. If you need help deciding on what option is right for you, just ask. If you choose to enroll in the dental plans, there are no changes in rates or plan design for 2016. Make sure you verify your dentist is in-network before selecting a new plan. Just like the dental plan, the city provides a free base vision plan to all benefit-eligible employees, which covers one annual eye exam for a $10 copay if you use an iMed provider in the Select network. You are automatically enrolled in this benefit unless you choose the buy-up plan. If you need additional coverage for yourself or your family members, you can elect the buy-up plan, which includes coverage for frames, lenses, and contacts. There are no changes in rates or plan design of the buy-up vision plan for 2016. There are no changes to the rules of the FSA, but it is important to note that if you want to participate in one or both of the city's flexible spending accounts, you must re-enroll each year. Your 2015 FSA election does not automatically carry over. The maximum you can contribute is $2,500 to your healthcare FSA and $5,000 to your dependent care FSA. And remember, the IRS will allow you to roll over up to $500 into the next plan year. Remember to pay attention to the service dates when using your FSA card to pay bills in 2016 if you have a flexible spending account. You cannot use your FSA card in 2016 to pay for a 2015 expense. Those bills can be submitted through the website. Call Employee Benefits for help. Finally, a very important reminder. FSA HRA dollars can only be used for eligible tax dependents. For more information on flexible spending accounts, review the 2016 Guide to Your Benefits or visit wageworks.com for a list of eligible expenses. The city has a new life insurance vendor, The Hartford. Just as before, the city will still provide basic life coverage equal to $50,000 at no cost to you. But with the new vendor comes a new opportunity to enroll. During annual enrollment, there will be a one-time option to elect supplemental life in the amount of $10,000 for you and $5,000 for your spouse without answering medical questions, only if you've previously waived either coverage. If you are already enrolled in supplemental life, each year at annual enrollment, you can increase your supplemental life coverage by $10,000 or $20,000 for a maximum coverage amount of $100,000 with no medical questions asked. If you make any other changes to you or your spouse's coverage, you must complete an online evidence of insurability for approval by the insurance carrier before your coverage increase can go into effect. More information on the city's life insurance is in the 2016 Guide to Your Benefits. You can only enroll in Vacation Cell, formerly Benefit Bucks, at annual enrollment, and you'll need to re-enroll every year. Your 2015 election does not carry over. Remember, you can sell up to half of the leave you would accrue in the coming year. You can also enroll in the Sick Leave Bank at annual enrollment. This is the only line of coverage that will require a paper form. See Employee Benefits if you would like to enroll. Remember, if you have enrolled in the past, you do not need to re-enroll. The city makes several voluntary plans available to employees. Short-term disability, lifetime benefit term insurance, cancer insurance, critical illness insurance, and accident insurance. If you're interested in adding or dropping coverage, you can only do so during voluntary annual enrollment, which is the last 2 weeks of January. The phone numbers and website are located in the 2016 Guide to Your Benefits. Now it's time to enroll. PeopleSoft will be available for annual enrollment elections starting November 1st. You have until November 30th to make your 2016 benefit elections. Enrolling is easy. Just go to Inside Knoxville and choose Online Annual Enrollment 2016 from the citywide drop-down box to get started. Your PeopleSoft login is your employee ID. If you don't remember your password, click the Forgot Password link or call the help desk at 215-3030 to get your password reset. If you don't go online to enroll before November 30th, your 2015 benefits will continue in 2016, except FSA and Vacation Cell, formerly Benefit Bucks. You must re-enroll to continue these plans. Everything we've talked about here is in your 2016 Guide to Your Benefits. And as always, the guide is available online at knoxvilletn.gov/benefits or on the Employee Benefits page on the intranet, along with more detailed plan information. Employee Benefits is available to answer any questions you may have. Call them at 215-2111. Thanks for listening, and happy enrolling!